Welcome to part 2 of the gamma variant. If you haven't already, go to gamma variant part 1 and then start on gamma variant part 2. Now I'm going to talk about the reaction of Brazilians and the possible hopes for the future. Now we can see in the table on the left, the two vaccines that have been field tested and have been shown to be effective against the gamma variant are actually the Pfizer-BioNTech vaccine and the AstraZeneca vaccine. Now, although there is a 30% difference in effectiveness, it's still a good first-hand approach to treat the gamma variant. However, I think the hesitancy is not due to efficacy of this vaccine. It's more because of negative press that it received because of clots. In Brazil, there's a lot of vaccine hesitancy, and it's not because they're anti-vaxxers. Most Brazilians are waiting for a better vaccine. They're waiting for the Pfizer-BioNTech vaccine, which has been shown around the world to be one of the best vaccines. But the question is, should the majority of Brazilians wait, or should they actually get what's available to them? And that's a hard question to answer, and the answer really depends on each individual, but they should be given the facts about the two vaccines that are currently available, the AstraZeneca vaccine and the Sinovac vaccine. A lot of people think the reason why people in Brazil are waiting for the Pfizer vaccine is mainly because of brand recognition. But if you look at what brand recognition is, it comes to three parts. Recognition is due to a brand being easily recognized by its logo, its tagline, its color, and its palette. Now, we know that Pfizer has many blockbusters under its belt. Things like Viagra, Zoloft are all owned by Pfizer. Lyrica, Effexor are each blockbuster drugs which are highly effective, and it's given this company a reputation of excellence. Also, when you're buying a Pfizer product, you're usually knowing that you're dealing with a reliable product, best of its class. Plus, the company strives to be informative. It has a lot of sales reps that actually talk to doctors around the world about the effectiveness of their products, and also they don't hesitate to put journal articles. In fact, they were one of the first companies in the world to publish data on their vaccine. So it has a high degree of confidence not only to the public, but doctors and pharmacists alike. Now, if you look deeply, it's got also more to do with its effectiveness than brand recognition. It is a fact that Sinovac is only 50% effective, and the AstraZeneca only, at best, does 90%, and at worst, 60%. Now, people are aware that 100 million doses of Pfizer are coming soon to Brazil between September and December. People don't really understand that this could take some time, and in the meanwhile, people could die. Now, also, Novavax promises to deliver a cheaper vaccine in 2022, but I think in Brazil, they will be still going for the brand name, which is Pfizer-BioNTech. In addition to this, President Biden has actually pledged 500 million doses to the UN, and I believe because Brazil, being a lower socioeconomic country, has a portion set aside for them, but I don't really know how much or when that would be coming to them. Although clots from a vaccine is a serious issue, the numbers are quite low. Atagi has reported that the highest level of clots is about 2.9 in 100,000, and that's in the younger age group. Now, what's good to know is these clots are actually treatable. There are immunoglobulins which can reverse the effect of the clots. So it's not like you're dealing with something that can't be treated anymore. Also, until such time as Pfizer becomes widely available, I think people in certain age groups actually think long and hard whether they should be waiting or whether they should get an effective treatment that could protect them from death. Death and a clot is the choice that some people will have to make, and a clot that's treatable is certainly less of a problem than dying. It would be nice to think that everybody in the world would be able to get the best vaccine, which is Pfizer-BioNTech. Unfortunately, it doesn't seem like that will be the reality, at least not for now. At the moment, Pfizer-BioNTech only has 4 factories around the world manufacturing the vaccine, and it's going to take a lot of other companies to work together to provide more doses. Also, Vaccines require funding. People have to realize that Pfizer-BioNTech are actually selling their vaccine at a near cost level. So until they get enough revenue, they won't be able to provide new factories. So in the meanwhile, the next best option is sometimes the most viable option. So although AstraZeneca may have clots, it may be the choice that a lot of Brazilians have to make now rather than later, because there may not be a later if they get COVID-19. It would be nice that the billionaires of the world would fund the poorer countries so that they could all get the Pfizer-BioNTech vaccine. However, it would be a great task for any of them to raise funds so that the world could have 10 billion doses of the Pfizer-BioNTech vaccine. However, that's not either also impossible if you consider how much money every year is spent on warfare and people arming their countries. If they devoted some of those funds towards producing the vaccine, then there wouldn't be such a problem. People today need to stand together and give each and every country the chance to use the best vaccine.